And welcome back to Breakfast Television. Some serious conversations between patients and doctors need to happen. Prostate cancer is the fourth most common cancer in Canada, with 1 in 9 men being diagnosed in their lifetime. So research has also found that men with prostate cancer don't feel empowered and proactive when it comes to discussing their treatment. So today we want to talk about an initiative called the Crucial Rehearsal. It's a website. It is very important, and that's enabling men to take charge of their prostate cancer care by helping them get prepared to talk to their doctor. Joining us this morning is Dr. Kylea Potvin, who is a medical oncologist. For more information, of course, we're going to check out crucialrehearsal.ca. But Dr. Kylea, good morning. Thank you for joining us.
My pleasure.
All right, we got to talk about this. Crucial Rehearsal, sites like this, why do they need to exist? We're kind of seeing it in that video at the beginning.
Yeah. This is about self-empowerment. This is about self-advocacy for patients. This is such a common disease. It affects so many men, and it's intensely personal. It's terrifying when people get a diagnosis. They can be paralyzed by it. They don't even know where to start in terms of thinking about it. So having something that can be a guide or a framework to get men thinking about things they might not have, their priorities, this is absolutely crucial in terms of helping them make the decisions that best suit, their life, their needs.
And I think you've probably seen it more than anybody, but I see it with my friends, no one, when it comes to men, we don't talk about our health.
Yeah.
Mental health especially, but physical health, because we're a little bit ashamed, potentially. Why is it so important for men with prostate cancer to really step up and care about themselves and make those conversations happen?
Yeah. Well, the thing is, there's so many options out there, right? So, that's the beauty of cancer care now. The research is guiding us. We have so many more things that are helping extend survival, but everything comes with trade-offs. And for men, if they don't actually understand themselves, am I somebody that I care about my physical strength, I care about being at the cottage, I want to travel. If they don't understand those things, how do we fit managing their cancer in with that? How do they understand how treatment may impact their ability to do those things? So it's really, really key that they actually can start thinking about this, framing it, and coming to have conversations with their healthcare providers so we can guide them in the best way possible for them.
And then the role of the doctor, the responsibility potentially to have those conversations back to the patients. What can they do at the appointments, asking questions and things like that?
So for doctors, I think one of the things that we can sometimes be quite bad at is listening.
Right.
And this is something that I would say, whether it's doctors, whether it's caregivers, other people involved with the patients, we have to learn to listen better. And that's why it's a dialogue. We're there to provide our expertise. We need to know the evidence. We need to have that information for them. But for me to actually help someone make a decision, right? This isn't the paternalistic thing anymore. A lot of men will come in.
Yeah.
Some of them may come from an age or an era where they're actually not comfortable. They come in, they expect the doctor just to tell them what to do. Well, that's changed.
Yeah.
We really want to engage in that dialogue so that when we're offering people decisions, their priorities really come into it. So we actually have to listen. And in fact, as much for the patients knowing the right questions to ask, comes back to us as well to remember to ask patients, what really matters to you? What's the priority in your life?
And that's it. And then crucialrehearsal.ca. I went on the site last night. I think it's great the way it helps guide patients to speak with doctors. Tell us more about this.
Yeah. So crucialrehearsal.ca, the reason I'm here talking about it is because this is a really amazing tool. One of the things I love is it had patient engagement in it. You really have to go to the people that are affected. You have to go to the source to understand what matters. So it had patient engagement. It's a wonderful, simple site. You just need an iPad, an iPhone, anything to get to the site. 3 simple questions. And the first one is asking guys about their priorities. When people are first diagnosed with cancer, it's so overwhelming for them, and they're worried about their survival. They're worried about so many things, their families. They forget to stop and think about themselves. So the very first question is one about what are your priorities? So 3 simple questions that they go through. And what that does is it provides them even a script if they need it. Because some people really, they don't know where to go. They don't know what questions. So this gives a framework. It gives something they can actually print out. They can take it to their appointment. So if they're feeling overwhelmed, they have something to refer back to.
Yeah.
And there's a wealth of just general information about prostate cancer that I think is really helpful in really simple language that can truly help men have a better understanding of the disease.
There it is. I encourage everyone to do this. Crucialrehearsal.ca is where you can go to check out the website, have those conversations. And look, I got my first prostate exam this year. I'm not ashamed to say it. So guys, go out there, take care of your health, and do that.